Hi, I'm Tracy. I am the CCIO for Dedalus UK and I am a nurse by background, but I've been working in digital healthcare space for the last 10 years. So when I first qualified, we were entirely on paper, but as we moved to digital without GS1, we felt we were really moving forward. However, now looking back, we would have instances for patients information being on two separate records. So patients would come to hospital, they'd get a medical record, they'd be readmitted 2 days later, and they'd get a whole new number for their hospital record. So you would be documenting in one of two records, the information wasn't pulled together. Also, if you had an admission to another hospital in another part of the country, again, you'd have disparate record. You didn't have any way of having a single identifier for the patient. The NHS has moved forward somewhat, and they have a unique NHS number, but again, it's not a unique identifier that can be used globally. We also have improvements from GS1 where we are now able to track sterility in theatres. So we can track not only that something's been sterilised, but how long it's been sterilised for, if it needs to be re-sterilised, what the content of that tray is. We're able to easily, with a scan, look at patients' whole medical record information, what medications they're on, administer medications with a scan of the barcode as well. And also it's improved safety around blood transfusions. So you can track the blood from the source to the administration with a barcode scan. So by using the barcode scan, immediately you can pull up the whole patient record. You can be confident that the information that you're getting is entirely correct. You can then obviously speak to the patient to confirm the information that you've got there is correct, but you know that when you scan the correct barcode, all of the information that you've got is correct. Historically, that wouldn't be the case. You could look for a patient's medical record number, as I've said, and it might not be the whole record. There might be information missing there. Also, you can be confident when you're scanning blood transfusions or medication information that the information you're pulling up is absolutely correct. So I would say it's leading to patient safety around blood transfusions, medication and misidentification of patients. The data there is correct, and you can be confident that the patient's correct. I think we're moving now to an era of population health and AI. So if we don't have the source information for each individual patient being correct, so that the basic data, then all of the rest of the information is completely meaningless. So I think with the GS1 standards at the core, we'll be able to adopt and act on that population health data and that wider ecosystem of information that we have around patients and populations.